Dr. Director General Health Services, Professor Balaji, Consultant Oral and Maxillofacial Surgeon, Professor Ramalingam, Senior ENT and Head and Neck Surgeon, Dr. Murthy Sankar, Consultant Orthopedic Surgeon, Dr. Abilu Ramesh, Senior Consultant Anesthesiologist. My colleagues from the medical profession, members of the press, distinguished guests, ladies and gentlemen, good evening. On behalf of the Ministry of Health and on my own behalf, I have the pleasure to welcome you all to this press conference, which will be followed by cocktail meeting. This evening, we are privileged to have amongst us four renowned doctors from Chennai, India, namely Professor Balaji, Professor Ramalingam, Dr. Sankar, and Dr. Ramesh. They have come all the way to share their expertise in their respective fields and help to operate on complex cases which otherwise would have been sent abroad for treatment, and at the same time for visiting experts to come and operate on complex cases in our hospitals on a voluntary basis. The presence of the Minister this evening is a testimony in his endeavor to strengthen the close collaboration between the different institutions and the Ministry of Health. Without further ado, I will now invite the Honourable Minister to address the audience.
Doctors from public institutions, Ms. Sampat from the Cardiac Center, Dr. Sunil Ganes. As we have heard from Dr. Ahmed, it is a great privilege for us in Mauritius to have the expertise of world-famous doctors from India. And this is in line with the new policy that we have to change the system when we were sending patients overseas. Now we are trying to get the very well-known and skilled surgeons to come from overseas to treat on our patients. Yesterday I was talking to Professor Balaji, and he said one thing which really struck me. He said that if you have a lot of money, you can go anywhere in the world and you will get the treatment that you require. But that doesn't apply to poor people who don't have the means. So with the new system, we will be able to provide to any Mauritian the best treatment that is available anywhere in the world. From India will be of great assistance to all the patients who will be treated. As you have heard from Dr. Ahmed, the system we had, we were sending very complex cases overseas, but those cases had to meet certain eligibility criteria. So there were some people who were deserving, were not able to go because they did not satisfy the eligibility criteria. Now all this will disappear because when doctors are coming from overseas, Balaji is world famous. He is, I think I will let him speak in a short while, but he has published lots of very heavy books. Professor Balaji, when he gave me it made sense with the luggage allowance that I had. But anyway, Professor Balaji is somebody who is world famous. He works all over the world, and I'm sure that his expertise will be of great benefit to the Mauritians generally. To all those who are in need of his expertise, he will be able to tell you what is his expertise. Generally, it is something to do with plastic surgery, but very complex plastic surgery. Dr. Ramalingam is Professor Ramalingam. He is known to Mauritius. You have been coming here for a number of years. Yes. But it's good that to meet the members of the press because they may not know exactly what it is that you do when you come to Mauritius. But I'm very happy that our booties are working during the weekends. Because otherwise our routines take the weekend off. But anyway, I'm very glad that we have been able to do this, and this is the beginning of the new system that we will be having, so that we'll shift from we'll shift from the existing system to the new system. So Professor Balaji, I know you have also given a lecture today, which was well attended by the doctors.
Actually, Honorable Minister came to India 2 months back. So Minister has chosen, he has not chosen the consultant from one hospital. He has, they are shortlisted. He has chosen individually who are good in the field. As you all are aware, the Minister's first address, he said, the rich can go to the best hospital in the world to get the best treatment. We are all in the best hospital in the world, but we are not all the time treating poor patients. So the poor cannot afford. So Minister's point is to bring the top consultant to this country to serve the government. It's not only serving the people of this country, that was the agreement we made with the Minister when he came to India, to come and operate, consult, not only that, to work with all our colleagues like you, all of you, all the doctors for their cooperation last few days. And it's not that the doctors here don't know, they are all very good doctors here, but the point is certain technology, certain countries are improved. So that technology we would like to introduce to the surgeons here, and with their cooperation, we are able to do more work. As our Honorable Minister said, we are not only to operate the continuing medical education program. Today I had a half-a-day program actually. It was very well attended in the University of Mascareignes. Nearly 80 to 90 doctors were there. And maybe I would like to request to the Honorable Minister, during our visit, one of the visit, if a live surgery can be, not all the doctors can see the surgery. Only few in the theatre will be able to assist and see. So what we do in India, it is telecast outside to the conference hall. So many doctors can see. And we are very happy. We thank you so much for your hospitality of the Mauritius. As our Minister said, we have affection between India and Mauritius. In all levels, from the Government of India to the Government of Mauritius, in all levels we have cooperation. We are happy to work and cooperate with you, sir. Thank you, sir. And now, actually, India, as you know, the continuing medical education program is always it goes on, and we have the CDE points. Now, the Medical Council and the Dental Council of India have made things mandatory to have the CDE points. And you need to renew your registration by CDE points. So we have many conferences coming in the world, especially Chennai. We have the 10th World Craniofacial Conference, which is going to be held in the Hyatt the end of October. So I am inviting the plastic surgeons here, especially 2 youngsters who were all the time with me yesterday, as well as the other dental surgeons and others. I have requested the Honorable Minister to be the chief guest and inaugurate the conference. So the World Conference, the 10th World Conference, I have already given the invitation to this. We request on behalf of the organizing committee and the International World Cleft Lip and Palate Foundation, we request the Minister to come and inaugurate the conference. Thank you, Minister.
Thank you very much, Professor Balaji.